large share, about 45% of the revenues, are only growing at less than 3%. And so if you have an overall growth rate of 9%, some revenues are growing at 3%, then the rest has to grow at a much higher rate. That's what's going through the roof, and that's the spread of the line above the dotted line, above the green line, is the growing problem of the growing structural problem related to healthcare. But healthcare is not the only structural problem. There's the problem with the gas tax and the fact that it's a gallonage tax, which you know. That means that as the price of gas goes up per gallon, the percent you're collecting goes down, and the revenue goes down as people use less. The sales tax, as a percentage of the taxable sales as a percentage of the gross state product, has been dropping for the last 30 years. So that you're collecting less revenue as a percentage of the economy than for one of our three major taxes. So the problem is, that trend is as bad as a revenue trend that's going down or growing slower than the economy is worse, or as bad as a spending trend that's growing faster than the economy. This chart essentially shows, as a percentage of the economy, education costs and healthcare costs. Education costs is the lower line, which is showing up as black. It's actually red here. But what you see is over the last 16 years that education costs have been between 5.5% and 6% of the gross state product, which is basically pretty low. The healthcare costs, on the other hand, have gone from more than 10%, almost 11%, to more than 17% over those same 16 years. And these are the costs that Vermonters face. So the basic message about how to deal with this budget problem is that that it's a two-part problem. There's a cyclical problem, which you can deal with temporarily with temporary measures like I mentioned, and there's a structural problem that actually requires reform, fundamental reforms, and one of the biggest ones is healthcare. But the other ones we can identify are tax issues. The fuel taxes and sales tax are the most obvious ones. But the point is that this budget won't balance on a sustainable basis without structural reforms, and that the problem we keep running into every year, when you have that sinking feeling in December when you're coming back and wondering what the bad news is going to be when you get here in January, is inevitable under a scenario where you have revenues growing slower than the economy, the state depends on, and costs that are growing much faster, like primarily healthcare. And essentially what's happened over the last decade is that to be able to balance the budget, the legislature has been, and the governor have been cutting back on state services over this period of time. In other words, because healthcare is eating up such a big part of the budget, and it has to be funded, then the result is that there's little that's left to deal with the rest of the budget. So that creates the kinds of crises of delaying transportation projects, the shortfalls within the system throughout, and actually even things like reforms that could happen within government in terms of service reforms, the kind of thing John was talking about. Even the money to deal with that stuff has not been available because everybody's been in this we're short of money problem. So in summary, what I would suggest is that a lot of the information the way that information is coming to you is not enough for you to actually make the decisions you're forced or being asked to make. In other words, with the focus on revenues and very little information similar information on the services side, the cost of providing services, it's very difficult to make the decision about do we need to raise revenue in order to fund these services, or can we cut services in order to meet this this revenue target. And so the failure to get that information, it leaves persistent problems. You keep coming back here year after year facing these problems over and over again. And so, as I said, the budget problem is two parts and need two ways to solve it. One is in the budgets you're facing the next year, this year, next year, the year after, that you need a balanced approach that involves revenue, including revenue to solve this recession part of the problem, or the cyclical part. And then study of the long-term revenues and needs of the state. I would suggest that in addition to a current services budget, which would require legislation in order to have that be in place, is that you also ask or order a study of the budget issues that I'm laying out. This is not we're not in a position to do an exhaustive study. We can only tell you by looking at some of the surface, the most obvious things, that these are the problems according to the way we see it. But what's needed is for you to actually use an approach like this and to deal with the structural issues and structural reforms, is to actually have a study that looks at the budget problems, the revenue issues that are contributing to those, and what's necessary to get the state back on track, or get the budget process back on track.
Questions?
So you're saying you think we can close the budget gap by looking at insurance, health insurance only, and excluding human services?
No, I'm not saying, what I'm saying is that
There are two big pots of money that are sort of sacred around here, politically. It's education and human services. That's where the real money is.
those are the two biggest expenses.
Those are the two biggest expenses, and those are the two biggest political hot potatoes,
Right.
for obvious reasons.
Right.
I'm just wondering, are you saying that you can address this problem? You think we can address this problem by leaving human services out of it?
Okay, well, first, no, I'm not saying that. First of all, what I'm saying is that in the short term, you have to deal with the problems. But you can't reform the healthcare system in Vermont in 1 year, or even in 2 years, probably. So you have to deal with the budget problems in the short term, the way we've been dealing with short-term budget problems for the last 15 or 20 years, or 15 years at least. What I'm saying is that healthcare, and I'm not talking about health insurance. I'm talking about the cost of healthcare, the $4.6 billion or whatever the latest number is that we spend on healthcare in the state of Vermont. That every individual, every one of us, every business, all the schools, the state government are all facing the same cost increases, the 8 to 10% cost increases in healthcare each year. That then translate into insurance costs, they translate into Medicaid costs, they translate into education cost increases. That healthcare, those healthcare cost increases are driving these budget increases. And so what I'm suggesting is that with a two-part strategy, that you deal with the immediate budget issues as a temporary problem, and then treat this reform as the long-term way to have sustainable balanced budgets. So no, I'm not saying anything about whether human services should be on or off the table. I'm making this one point. And also, but I also want to add that it's not just healthcare. That happens to be the biggest, biggest because it's 25% of the budget, and because it's growing at a rate that's fast, and is a big part of the budget. Corrections is obviously a problem. You know that. It's a much smaller part of the budget, but it's also has been growing at a fast rate. These revenues that are growing slower than the economy are also a problem. So that's why I think, while there have been sort of little snippets about trying to deal with the cost side, there's a tax commission, there's really no place where this discussion about what is the problem, if we want to have sustainable budgets, what are the things that we need to be looking at to understand what the problem areas are, how they're affecting us, how they've affected us over the last 10 or 20 years, and then how do we plan going forward.